What are the long-term health impacts of gluten on your autoimmune system? Have you ever wondered how gluten might affect your immune system over time? This is an important question, especially for those who may have gluten sensitivity or celiac disease. Gluten can trigger a range of responses in the body, particularly in individuals with these conditions. In celiac disease, gluten is not just a harmless protein. It can provoke an immune response that damages the lining of the small intestine. This damage leads to chronic inflammation and makes it hard for the body to absorb nutrients. Over time, this ongoing immune activation can increase the risk of developing additional autoimmune diseases. When the immune system mistakenly attacks the body's own tissues, it can lead to conditions such as thyroid disorders or rheumatoid arthritis. When someone with celiac disease consumes gluten, their immune system produces inflammatory cells and antibodies. These substances can erode the intestinal villi, which are tiny finger-like projections that help absorb nutrients. This erosion can lead to nutrient deficiencies, affecting overall health. Furthermore, chronic inflammation in the gut can disrupt the balance of intestinal bacteria, which may contribute to the progression of autoimmune diseases. Removing gluten from the diet can help reduce this inflammation. Many people find that eliminating gluten improves their symptoms and may even prevent further autoimmune complications. However, the relationship between gluten and autoimmune diseases outside of celiac disease is not as clear. For example, in Hashimoto's thyroiditis, some studies suggest that eliminating gluten might be beneficial. However, there are also warnings that a gluten-free diet could lead to nutrient deficiencies if not managed properly. Similarly, some individuals with rheumatoid arthritis report symptom relief on a gluten-free diet, but this response varies from person to person. Understanding these impacts is essential for navigating gluten-free living. For those who are sensitive, gluten can act as a trigger for autoimmune reactions. Adopting a gluten-free diet can be a key step in reducing inflammation and protecting intestinal health. It is also vital to maintain a balanced gluten-free diet to avoid nutrient deficiencies. Working with healthcare providers can help monitor autoimmune health over time. In summary, long-term exposure to gluten in sensitive individuals can lead to immune system activation, intestinal damage, and an increased risk of other autoimmune diseases. A carefully managed gluten-free lifestyle can help reduce these risks and support overall health.